All right, well, thank you for being here. I want to welcome you to our presentation. My name is Joe Emerson. This is my wife, Sarah Stretch. We founded a nonprofit called Blue Skies Ahead. It was born out of our own personal experience with healthcare avoidance. And we are a nonprofit that's dedicated to helping create a culture of wellness within aviation. Hold it closer. That's why she's here. She makes me better in so many ways.
I learned that taking care of my mental health didn't mean giving up on my dreams. It meant taking the steps necessary to come out stronger.
I have no regrets for taking care of my mental health. And I know that since I've been back to work, I've been a happier, healthier, and better pilot than I was before.
I struggled for nearly a year until I realized that my depression had manifested itself in ways that were intruding on my personal life. I want other pilots to know they are not alone.
After finally seeking treatment, I have been able to learn a lot about myself and find the hope and relief that allows me to live with a more positive outlook on life.
There is so much more value to life than just flying. If you're on your own mental health journey, know that you are not alone and there's always hope on the horizon.
This difficult journey has made me a better father, a better husband, a better member of my community.
I've become a person who is no longer depressed, and my anxiety has entirely subsided. I knew I made the right decision for myself.
For a long time, I avoided treatment for my insomnia. It was a really tough decision, but the very second that I decided to choose myself over my career, I felt a weight lift off my shoulders. That reason alone was enough to make it all worth it.
So what we find anecdotally talking to aviators who've gotten the care that they need, whether it be physical or mental care, they are almost always better for it. I should say almost always. I only put in there because I don't know, right? But when we get the care that we need, we're better for it. So why is it that over half of us avoid health care, whether that's physical or mental? What is it about aviators that keeps us in fear and out of action? And how do we create a culture where care seeking is incentivized and encouraged? What do we do? There's two definitions of health that I wanted to point out. One's a little more antiquated than the other one. As you look up on the slide, what rings true to you in terms of defining health? Is it the absence of illness or injury? Or is it a state of complete physical, mental, and social well-being, not merely the absence of disease, or the word that I'm not going to pronounce incorrectly? What rings more true to you? If we are undiagnosed, right, okay, so I think most of us, myself included, I think that's a more accurate definition of health, and over time, this is the accepted definition of health. What do you think we are measuring when we participate in the aeromedical process? What definition is more important to the overall well-being of the individual? Right? Being healthy is an active process. It's one that I have to work on daily for what I deal with. And now you get to hear that.
So up here is a slide that talks about health hesitancy, and reverse malingering is a definition that has been kind of coming up through the research, and it's falsely exaggerating or concealing symptoms of illness or injury, often to stay at work. So these are just a few of the health issues that are or that affect aviators. Cardiovascular issues. Pilots generally don't want to go seek care when or if they have chest pain. They're actually takes longer for them to actually go to the doctor before the general public do. Sedentary lifestyle can actually and holding your urine can actually lead to kidney disease or more kidney issues, which you guys, pilots can find obviously when they're in the flight deck and are not able to go to the bathroom as often. Insomnia, alcohol use disorder. In an anonymous study of airline pilots, more than a third of the sample showed alcohol misuse, depression and anxiety, preventative screenings. Pilots and cabin crew have approximately twice the incidence of melanoma compared with the general population, and that's just melanoma. There's other cancers and other things that we see that have caused health hesitancy as well. There's this tough it out mentality and lack of peer and career support surrounding healthcare that creates this culture of health hesitancy. Okay, so within there's behavior change research. There are several theories, but I'm going to just talk about two of them today. The theory of planned behavior and the social cognitive theory that focus on how and why we change behavior. And so within the theory of planned behavior, you can see perceived outcomes. So these are factors that predict help-seeking behavior. So if you have an anticipated negative outcome, such as I'll lose my medical, I won't be able to work, I won't be able to have income coming in or the amount of income that I normally have, it can lead to avoidance. Perceived norms, so you've got cultural narratives where the help-seeking is minimized within this culture, and so individuals refrain from it. And then you have perceived control. So a lack of trust in the system, fear of consequences can all deter individuals from seeking care. So these responses, these three perceived outcomes, perceived norms, perceived control, they're all influenced by the environment that you're in, the culture, and the systems. Simply urging individuals to get help is not going to be enough. So the key takeaway from this is that help seeking is driven by perceived risks, social norms, and control, rather than just intentions alone. And then as we look at the social cognitive theory, it tells us that behavior, personal beliefs, and the environment all continuously influence each other. So the human behavior is shaped by these three things. In aviation, we often focus only on the behavior, only on seeking help or speaking up. But we ask for behavior change without changing the environment in which the behavior occurs. Aviation environments often include the fear of losing medical, certification, unclear and confusing pathways to care, and punitive or career-ending outcomes. So avoidance is not a personal failure. It is actually a predictable response to the system. So personal factors that shape how the environment is interpreted, identity and professional pride, risk perception, stigma around mental health and past experiences. So we feel, jumping around. Anyway, stories matter. That's where we're kind of coming in with this, is that people, when colleagues share how they get help and then lose their careers or have negative outcomes, Okay, that's going to be a negative impact. But what about when people share the positive outcomes? When we don't hear that as much, we don't see that as much. So if we can start changing that, sharing how people are able to get through their health issues and get to the place where they are successful, then that's how we can maybe shift the culture. These three things are kind of like, if you, it's in a triangle shown up here because it's kind of like a rubber band. Like they all have to work together. There's just not one that's going to change the other. They all kind of like one pull on each other. So back to the storytelling, it's just like we feel that the lived experience reshapes the beliefs, okay? And then the belief reshape the expectations reshape behavior, and expanding expectations around this help-seeking idea, okay? So I think that's all I was gonna, there's just a lot on here on my notes, and that's all I really wanted to talk about with that, is just that like, we need to see it as a whole and holistically, not just as one thing or just telling somebody to go get the help that they should be getting. Peers are crucial in this. So we have peer support programs, and those are great, but we also see that a lot of this can be set with peers. And it starts sometimes really early with CFIs, right? So like, this is where you should go to get your help seeking instead of maybe getting the actual help that is necessary. So being able to work through these, going from the CFI, to the culture of the flight schools, onboarding, all these, if we have more stories and more information that are like true and less health hesitant, then we change the culture. So I know he's gonna then talk about how we can use the Swiss cheese model.
All right, so we wanted to talk about safety and how safety is impacted by this behavior, right? And so we wanted to take something that's familiar to most aviators. So if you're an aviator, I'm sure you've heard of the Swiss cheese model, right? What we try to do is we try to identify that we've got all these threats we talked about, right? We've got lifestyle threats, we've got all sorts of career pressures and other things that are coming at us that are impacting our health in some way, shape, or form. And we want to be into this preventative area of care. We want to be seeking care early. We want to be getting the care that we need, if we can, before symptoms develop or where symptoms are minor. Right now, if we're falling through the cracks and we're not getting the care that we need, we're more likely to continue to fall down that scale because unaddressed health concerns, physical and or mental, eventually get worse, right? And we want to stop the delay, because as we do, right, there's more holes in this. There's more chances that we get to a medically unsafe condition. You may not know my story, you may know my story. I ask you to be curious and not judgmental if you do, okay? I am the product of healthcare avoidance behavior. It ended my career, okay? I will most likely never fly an airplane again, and I never have an expectation to do, and that may be the most appropriate thing for what my behavior caused. I have been and continue to be responsible for what happened, right? But we, as a community, need to start encouraging the seeking behavior. So that is what is going to either shrink these holes or add layers to the Swiss cheese model, so that we are realizing we are more than just aviators. Our value is not in our ability to fly or draw a paycheck. You are all worthy of care. You're all worthy beings, worthy of care. I'm going to talk just about how the culture shaped my health-seeking behavior and attitude towards healthcare. It started very young, 15 and a half years old, getting my first medical and student pilot certificate, so I could solo at 16, right? Because I am ambitious and I am going to be a pilot, right? This is all I want to do with my life. I go to my first AME, I come back to the flight school, I tell my CFIs about what the experience was like, and they said, Who did you go see? Yeah, don't ever go see them again. You need to see this AME. The culture starts with. And I didn't stay in that area. I went off to school and I go and see another AME. All the students were telling me what AMEs to see. I get my first airline job. You need to go see this AME who's got a practice above a gas station. In that office, that AME said, don't put everything down on your medical health care record. I only need disclosable items. I don't need to know about your dental visits, your routine checkups. Only disclosable care is. That's all I need. And I operated in that basis. And what that did to me over time is gave me the impression that I needed to continue to appear perfect on paper. And the way that gets accomplished is multifaceted. And it doesn't mean that I'm an evil individual, right? As Sarah pointed out. I don't have ill intent. I believe I'm behaving in the culture appropriately. When I get to my first airline job, at Airline Indoctrination, what did they talk about healthcare? They said, your medical needs to be turned into the chief pilot's office by the 25th. If it's not on the 25th, you're off the line and you're not gonna be getting money. Period, end of story. That's what we care about. Can you hold the certificate? The idea that I had to appear perfect on paper influenced my interactions with my primary health provider. If being honest means I'm going to start to not appear perfect on paper, why would I have an open, honest, and transparent conversation with my healthcare provider, let alone my AME? If I am not open and honest and asking questions and interactive with my primary healthcare provider, can that primary healthcare provider diagnose me or recommend an appropriate course of treatment?
The story was my cure. And this is so cool. There is actual neuroscience research to back this up. So when scientists hook up our brains to fMRI machines, when we write our stories, our brains form new neurological connections that help us to solve complex problems and actually heal old wounds. It's real. Not only that, but the simple act of listening to other people tell their stories releases dopamine and oxytocin, which are feel-good hormones that promote human connection and compassion. The story is good medicine.
All right, so my personal experience in getting the care that I needed involves a lot of storytelling. When I was in jail, and I was realizing how alcohol use had shaped my behavior. Right? I was put in touch with another aviation professional who had walked a similar path. Those open conversations where he told me his story and asked me about how I drank, I began to understand what my next step would be on the road to my journey. We feel, as an organization, that one way we can impact change as a small organization is through this storytelling, through shared personal experience. Because if you are in fear of the what ifs, what's going to happen if I go talk to my primary care physician about X, Y, and Z, we are kept in inaction. If you go to your peer support pilot and say, what's going to happen next? And they relay process. This is going to happen. You're going to have to do this. You're going to have to. This is your next step, and this is going to be the next step. And the path to recertification. Are you in action, or are you still in fear? Are you still in what if? If you hear a story of somebody who has gone through something similar and gotten the care that they need, and how much better they are for it, are you more likely to seek care?
Hi, I'm Troy, and I have been diagnosed with anxiety and depression. In the fall of 2022, after months of dealing with worsening symptoms of anxiety and depression, I made the decision to stop flying and seek treatment for my mental health. That came in the form of medication. And for a pilot, that's a big step because that meant I would be going a long time without flying an airplane. What I realized during that fall as I grew close to the decision to stop flying was that I had been dealing with anxiety and depression for a number of years. And it had always been kind of buzzing in the background of my life in a way that I can manage it from day to day. But that fall, after dealing with some other medical issues, the floor kind of fell out from underneath me. It took a relatively minor medical event to pretty much take all of my life away. At least that's what it felt like. And in a matter of months, I went from feeling okay most of the time to having routine episodes of severe anxiety and depression that left me on the floor of my living room crying and unable to function. And for a long time, I was able to work through this. And by work, I mean like quite literally go to work and fly and not let it affect me when I was at work. But as things got worse, I could no longer separate the two and keep them separate. Keep those kinds of things out of the cockpit. I realized that my career was not worth losing my health for, specifically losing my mental health. I didn't think that living a life of depression and anxiety, of hopelessness, of teetering on the edge of giving up everything was worth the ability to go get in an airplane and fly. But the reverse was true up until that moment when I finally decided this wasn't worth it. But when I made that decision, I was gambling that the system was going to give me my ability to fly back if I got healthy. Decided that health was what I wanted, so I stopped flying, started medication, and in a few months, I felt much, much better. It was the right decision. It's something that I probably should have done many months prior to when I made the decision to do it. But prioritizing my health, and for me that meant prioritizing my mental health over my career, meant that I was actually able to retain everything that I loved in life, my friends, my family, and then eventually my career. While it took a couple of years and some hard work, I did get my medical back. And now when I go back to work, I get to experience my job in a way that I had never experienced my job before, taking care of my mental health. Because my baseline is a much happier person. And when I go to work, I get to see work and experience work as a much happier person. I've got the resilience to work the necessary hours to do this job. I've got the resilience to change time zones, and to come home and still enjoy my life and enjoy all the things that are great about being a pilot. And all those things were a lot more challenging before that. It's a hard lesson to learn, but taking your health and putting it before everything else was the most important and best thing I've ever done. I'm Troy, and I was diagnosed with depression and anxiety.
So those are the stories that we want to try to tell. We want people to come forward and connect with us And hopefully through that, somebody will see themselves in that story and they will reach out for the help that they need. That's our goal. So these are our 3 pillars, or our missions, our mission within CSA. So Clear Skies Ahead's our nonprofit. We are focused on research, education, and support. So we know that through research, we can create or help move policy change. Right now, we're seeing the Mental Health and Aviation Act, hopefully will be getting passed soon. But we need more research, okay? We always need research to help move that. So our goal is to try to help with that. In education, being here today, talking to you, being here at this conference and talking to those that walk by our booth, and we can talk to them about everything that we've talked to you about today. We have started conducting webinars. But anyway, we know that like the education piece is an important piece in this health seeking. So getting out there and just sharing our experience. And then in support, we're here. We know that peer support and helping each other is beneficial. Pilots report 35% increase in self-reporting of mental health and fatigue issues when they feel support. So these are our 3 pillars in action. So when we talk about research, we actually just created an IRB. If you guys don't know what that is, it's an institutional review board. We're going to be conducting a trend study, and it's going to be a longitudinal study that will hopefully focus on the cultural change that we hope will happen within this environment. So watching how things move, especially after policy changes, and hopefully that policy changes soon. And then also just like our influence and influences of others in this area. We hope eventually, obviously, to with that study or other papers to be able to publish academically. And then in education, we have quarterly newsletters. We have had, if you guys were here earlier, Rainey had a presentation on stress. She's done a webinar for us, and we hope to work with her again. But these are all things that we're trying to do to, again, create a culture of wellness. And then in support, we have, we support a support group, a peer support group. They're called the Fellow Travelers. They meet every Wednesday, 4 p.m. Eastern, I keep saying Eastern time, Pacific time. This is a place for aviators to go to talk about anything they want to talk about. It's kind of based on a 12-step program, but it doesn't have anything to do with substance abuse. And that's free for anybody that wants to. And if you guys want information on that, you can go to our website, but you can also come by and stop by our booth. It's at 609. Again, on here, it's showing that our webinar that we had with Rainey. And then we just started this last month. We are going to have a monthly webinar based off of the HIMSS support for GA pilots or aviators, because we know that a lot of people going through the HIMSS process have support with the airlines, but not necessarily those in the GA environment. And so there's going to be, it's helpful topics such as like mental health. I know that they're planning on trying to have AMEs and psychiatrists come to the webinars and speak and open up for questions. So again, all free and all part of our mission to just spread this this hope in changing this culture in this aviation area.
All right. So I hope it'll change. Maybe it won't. There it goes. All right. Here's the thing, though. We are a very new nonprofit born out of our own personal experience. 100% volunteer driven. We have a very small reach. Why we're here is to connect with others Change in culture is multi-organizational. What we're doing here is community impact and culture change. Interpersonal dialogues at the booth, presentations like this, they only get us so far. The stuff we put on the web gets the views that it gets. Hopefully, if we have impacted you, you can be change agents for this culture that we all participate in. This culture is eventually changed by those who are in the culture, right? I'm not gonna scream against the wind and do anything. It comes from all of us. It's multi-organizational, it's multifaceted, and there are tons of organizations in this sphere, but really it comes down to us. What kind of culture do we want to exist in as aviators? What's important? So up here are some QR codes. You can link to our website. You can, and that we didn't format this slide. it's misspelled. Well, we like to leave a good impression, like to leave on a good note. I don't have the answers. I'm up here because my personal experience was impactful to me. And it's hard for me to be picky. I know I negatively impacted our profession. And I'm just trying to do what's in front of me as best I can. So thanks for listening to us today. Please come say hi. If you have questions, we can try and answer it. But again, I don't know. Thank you.
What would you say to a pilot who's at like a crucial stage in their career, such as they're in flight school, they're in INCOC, or they're going paycheck to paycheck as a CFI, and they basically literally can't afford a lapse in their certification?
That's a great question. I would say at the end of the day, the advice I give anybody, I always suggest to them that whatever care that they may need should take priority. And I would say that getting that care can be done with support. On our website, we host a page of support resources available to that aviator to make the next right step. There are tons of organizations. If you're a member of AOPA, they provide guidance, right? AMAS, you can pay or have a consultation. I would say if you have a medical issue that you feel could be a concern for your ongoing path forward in your career, many AMEs, HIMSS AMEs or senior AMEs will have a consultation with you that's not an evaluation. And you can talk about the hypotheticals of what the next step is for you